Okay. Good morning, everybody, and welcome to today's webinar, Drug-Free Schools and Campuses Act Updates and Review, a live stream webinar.
Good morning. This is Eric Davidson from the Illinois Higher Education Center. We are excited that you are with us today.
Okay. Good morning. Eric, I was opening things up, but I realized I have myself muted.
I think you're good now, Marianne, once I unclick you.
Wonderful. So I'll start. I want to welcome you all to today's webinar, the Drug-Free Schools and Campuses Act updates and review live stream webinar. I'm Marianne DeChristopher, and I'll be the moderator. I'm the coordinator of substance abuse services through the Office of University Life at the State University of New York, and I'm excited to have this opportunity today. Before I introduce our speaker, I have a few housekeeping items and to go over about this GoToWebinar platform. First thing you'll recognize, I'm not an expert on this, and I'm going to depend on Dr. Davidson here. First of all, I'd like to thank the Office of Alcoholism and Substance Abuse Services for generous support in sponsoring today's webinar, as well as their other efforts to address the impact of drugs and alcohol on college performance, change the culture on campuses, and collaborate with other state and local partners. For those of you who haven't used the GoToWebinar platform, as I am, we've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right-hand corner. You should be listening in using your computer speaker system. Next, we'd love to hear from you during today's presentation. If you have a question for our speaker, please feel free to send it through the question box in your GoToWebinar control panel. You can send in your questions at any time during the presentation. We will collect these and address them during the question and answer session at the end of today's presentation. Also, today's webinar will be available on demand after the live session. Links to online recordings will be sent to all registrants. Once published, the recording will be available through the YouTube and the Illinois Higher Education Center website at www.eiu.edu/IHEC. Once there, click on the Professional Development tab and click on Past Webinars. We've also added some attachments here, which are available through the Attachments tab at the bottom of your screen. There you can find today's deck and other related content. Lastly, we'd like to encourage you to share today's webinar with your social networks. We hope that you will use the hashtags, hashtag DFSCA, hashtag Oasis, and hashtag IHECAODV to share what you are learning and thinking about today's presentation. So without any further ado, I'd like to introduce today's speaker, Dr. Eric Davidson, who currently serves as the interim director for the Eastern Illinois University Health and Counseling Services, overseeing the university's health service, counseling center, student insurance, and health promotion programs. Sounds like he, like all of you, wear 27 hats. During the majority of his 22 years at EIU, he has led campus health promotion and prevention efforts. Since 2009, he's also directed the Illinois Higher Education Center for Alcohol and Other Drug and Violence Prevention, overseeing training and professional development for higher education practitioners, implementing campus substance abuse programming. Eric assists campuses with understanding drug-free schools and Campuses Act requirements, effective prevention programming, and assessment and evaluation. For those of you that are just joining, welcome to this webinar with Dr. Davidson. Eric, I'll turn it over to you.
Thank you. We are excited to be offering this webinar today, and I'm hoping that everything is working on your end. We know that sometimes with webinars, technology can be a challenge, so I'm going to be sending a chat message to everybody, just asking, can you hear us? And if you can go ahead and reply back in the chat box, which should be at the lower right-hand corner of your control panel. And I'm going to specifically point out to Emma. Emma, can you hear us? Let us do one other thing real quick. We have unmuted everybody temporarily. And we just want to make sure that everybody can hear us before we move on. Okay, it looks like several people can hear us, so we are good. So we are going to go ahead and move forward. As said, my name is Eric Davidson, and I work at Eastern Illinois University. And as we move along, we wanted to talk a little bit about the panel. You should see the panel on the upper right-hand corner of your screen. What you will see is if you have questions, you can respond to that question box. It seems as if many of you have done so already in response to the question whether or not you can hear us. Again, if you have questions, please put those there, and we will do our best to attend those as we go along. I want to start a little bit about not necessarily who I am, but who I am not. I think it's important for people to realize that, like many of you, I am an administrator. I am a practitioner. On my campus, I have had my hand on the Drug-Free Schools and Campuses Act mandates now for 22 years. So like many of you, it's been my responsibility to ensure that we have a comprehensive drug and alcohol prevention program. It's been my responsibility to collect materials, do a biennial review, pull people together for review, and make sure that the report has been done. For about the past 10 years, I've worked with the Illinois Higher Education Center in providing training, consultation, and technical assistance to schools in Illinois on the Drug-Free Schools and Campuses Act. And over time, that has expanded more to a national role, which is part of what brought me here to you today. I would like to say that I am not a representative of the Department of Education. I do not work for the Department of Education. And one of the things that I found is that sometimes people will be like, well, the Department of Ed said, and that does happen quite frequently. Today, a lot of my materials come from the Complying with the Drug-Free Schools and Campuses Regulations book. This is what I consider the drug-free schools Bible for us. But I have some caveats to say about this particular document. This particular document was last published in 2006, so it is easily 12 years old. If you think of the amount of time and processes that would have to have gone through getting this document vetted by the Department of Education before its release, the content and the information in this book is probably a little bit older than 12 years. So this is our definitive guide. It is our go-to book. It is the guide and manual that the folks from the Department of Education should be referencing when they come to your campus to do an audit. It should be the book that you reference in terms of anything that you do in terms of your policy notification and your biannual review. So a lot of the content that I have today comes directly from this book. Having said that, there is a lot of information that I will be delivering to you today that I have picked up in conversations that I've had with Department of Education folks, information that I have picked up from past trainings and conferences that I have attended to, other information that I've had from email conversations a long, long time ago. So one of the things I like to tell people is that a lot about the Drug-Free Schools and Campuses Act is really kind of shared through the narrative of storytelling. People hear about it, people have conversations, it's passed on to other people, which may aggravate some of the lawyers who are listening today. A lot of the things that are out there just aren't written down, or you have to really be able to go through the program review findings that the Department of Ed has written when they have found schools in non-compliance and take bits and pieces from those reports. So I will try to do my best to let you know if it's from the book, if it's from a presentation that I attended, or if it's through a program review. I always like to encourage people to think about substance abuse prevention in the 1980s and what was going on at that time. In the mid 80s, I would have been in my teenage years. I would have just started prevention programming as a junior high and high school student. I'm one of those kids of prevention that made a career out of my substance abuse prevention involvement during high school, and a lot of prevention programming was based upon factual information. The philosophy was if we could provide our young people with the facts, that would be enough to deter them from the evils of substance use, substance abuse. Also at that point in time, there was a large focus on self-esteem, getting to know yourself, having fun, and providing our youth and our college students with a lot of alcohol-free social options. If you also think about what's going on politically at the time, we had President Reagan, we had a strong Republican presence through our federal government system that really took a very strong and staunch anti-drug, anti-alcohol approach. And that environment and that setting really set up where we went and where we are today regarding the Drug-Free Schools and Campuses Act. With Nancy Reagan and her just say no, not just day no, that's a typo, I apologize for that, efforts, you will see the basis of the Drug-Free Schools. People often ask me, this hasn't been updated in 20, 30 years. You're absolutely right, and you see that. The fact that we have a policy notification that we send out that very much aligns with the need and the wants of the time to provide information to everybody about the dangers of substance abuse, policies, rules, laws. Again, it just really kind of captures that time period. When we look at the creation of the Drug-Free Schools and Campuses Act, it was codified in 1988 along with the Safe and Drug-Free Workplace Act. One of the other acts that kind of may connect with it is the American with Disabilities Act of 1990. And in 1990, we had the initiation of the biennial review process. So these dates are very key and important, and we will circle back to why 1990 is such an important year, particularly when it comes to biennial review and biennial review practice. Once the Drug-Free Schools and Campuses Act was passed, within the Department of Education, there was a Department of Safe and Drug-Free Schools. Now, this office existed between 1990 to 1998. For the most part, there was a very strong focus on K-12 systems, but this is the entity that was also responsible for monitoring and compliance of the Drug-Free Schools and Campuses Act at the higher education level. Then in 1998, that responsibility moved to the Office of Post-Secondary Education, where the responsibility of monitoring and compliance for the drug-free schools occurred between 1998 and 2010. This is key and important, and it's probably part of the reason why, if your institution has not been in compliance with this act, has not gone through the practice of being compliant, a large part of it is that these two offices really dropped the ball. They were not monitoring institutions of higher ed and their compliance with the Drug-Free Schools and Campuses Act. They were not having any compliance issues. They were not holding anyone's feet to the fire and saying, you didn't do this, you need to do it, which in turn really created an interesting culture within higher education. Over the years, I've given this training, and I've talked with a lot of different people from a lot of different institutions, and folks have really said a lot of things to me. I've had community colleges come up and say, Drug-Free Schools and Campuses Act doesn't apply to us because we don't have a residential system. Or, I've never heard of any community college ever getting in trouble for not doing this. I've heard there's no penalties. No one's ever gotten in trouble for this. So, it's not a priority. There's no risk for us to getting in trouble with this. I've had other campuses say, we don't have a lot of drinking on our campus. We don't have a lot of drug use. Some institutions have said we're a religious institution and our students sign contracts that they won't drink. So, this really has no relevance to us. I've had a nursing school say, this is not important to us. We cover these issues in our coursework. That's how we're taking care of it. And I often also hear, we do Clary, so we're fine. To the point where I even had one administrator say, if you can't tell me that my university will be fine for not doing this, or that anyone will not be arrested for not doing this, you're wasting my time. What I would say to any of you that have had those thoughts and those philosophies in the past is that times have changed. In the past, the stick that was used was that if you violate the Drug-Free Schools and Campuses Act, all your financial assistance, all your federal funding would be terminated, and that you might have to also repay back anything that you have gotten from the Department of Ed. And that's a pretty strong stick. It's a pretty big stick. And the problem was that they weren't enforcing the mandates. They weren't ensuring compliance. And no one ever had their financial assistance terminated. No one ever had to repay. And very few people were even having corrective action. And as I said previously, the Office of Safe and Drug-Free Schools and the Office of Post-Secondary Education were really in charge of that, and they weren't doing anything. But in 2010, we saw a change. And now that the Office of Federal Student Aid, the Clary Compliance Division, the Clary Compliance Team, is the group within the Department of Education that is really responsible for ensuring compliance with the Safe and Drug-Free Schools Act. And a large part of that relates to the death of Christine Ghast. Christine Ghast was a college student who went to go visit friends at Paul Smith College. Many of you being in New York may be a little bit more familiar with the story than a lot of folks. But to make a long story short, she ended up dying as a result of an alcohol-related snowmobile accident. Her parents, very outraged by the death of their daughter, this accidental death, and they became very strong advocates for substance abuse prevention. They attempted to sue the institution, and in that process, they became aware of the Drug-Free Schools and Campuses Act. They really questioned small Paul Smith's college's compliance with that act. In the end, the court sided with Paul Smith and said that they were compliant with the act, but that outraged the parents a little bit more, and they really became strong advocates. And really, it's through their advocacy and their work that this garnered enough attention to really set up the stage for where we're at now. In 2012, the Department of Education decided to do a compliance report. And what they, again, found out is that really there were no oversight activities regarding this mandate previously. There were no assurances that institutions of higher ed were in compliance with Part 86, which is another name for Drug-Free Schools and Campuses Act, and that there were some institutions that did not participate in Title IV that were not involved in this. One of the findings from that report is that they looked at 28 random reviews. They looked at 14 Clery reviews and 14 financial aid reviews. And out of those 28 reviews, 5 institutions were correctly identified and reported for non-compliance. That left 23. Out of the 23 reviews, 18 lacked enough documentation to support Federal Student Aid's office's conclusions that institutions were in compliance. 10 out of 23, the reviewers did not fully understand the requirements of Drug-Free Schools and Campuses Act, and they said that schools had complied when there was evidence to show that they were not in compliance. And 4 out of 23 basically documented that the institutions were not in compliance, but did not report that back to the department. So internally, there were a lot of problems and challenges with this particular act. And they realized that they needed to start doing some changes. For those of you that have been in the field for some time, you may remember in the fall of 2011 that we ended up getting a letter from the Office of the President saying this is going to become important. It's going to become monitored. We are going to hold institutions to compliance. We are going to start sanctioning institutions. We're going to start fining institutions. And that the Clery Compliance Division will be responsible for that. And since that time, that has actually ended up happening. Our friends at the National Association of Clery Compliance Officers and Professionals conducted a review. That review was held between January 1st of 2014 through September 1st of 2015, and they looked at over 260 Clery program reviews completed by the Department of Education. And out of those 263, they found 57 institutions were found to be out of compliance. At that time. But out of those 57 institutions, only 6 were fined as a result. So for those of you that may be interested in that report, you will find the link to that report. And when we send out the PowerPoint to everybody, you'll be able to look at that report at your free time, and we will also make sure that you get a link. Since that point in time, if you go to the Department of Ed's website, you will see that there were 23 non-compliant schools reported in FY16. There were 32 non-compliant schools reported in FY18. People always ask me, well, what happened to FY17? The way that the department reported out and summarized non-compliant schools during FY17 is different than the way they reported it out in FY16 and FY18. And part of it is just an inability of myself to be able to go through every single non-compliant final program review report of every school that was non-compliant in FY17. There's probably about 100 or so schools that were found to be non-compliant for CLARI, for financial aid, Title IV stuff, and I've just not had time to go through 100 plus reports. One of the things that I like to encourage folks is if you are the person on your campus that is responsible for CLARI, if you are responsible for the Drug-Free Schools and Campuses Act, anything like that, these two links will be very important. I have a dual screen and it looks like there is a technical problem with the screen, so some people are still seeing my slide deck and not the full screen. So let me see what I can do to correct that. And hopefully that has fixed it. That should fix it right now. So hopefully that has worked out for many of you. Again, these two links will take you to different reports. The first is the CLARI report. So if a school has been found in violation of CLARI, you can go to that link. You can see their final program review report. And a lot of times you can also find the report that will talk about what their sanctions are, how much they've had to pay, those types of things. The second link goes to the data center. It ends up being an Excel file. You can see what schools have been audited, if they've been in violation for CLARI, if they've been in violation for drug-free schools. And then if you click on the link of the school, it will actually take you to their program review as well. Now, one of the questions that I often get a lot of times is, how are institutions audited? Jim Moore, who is the director of the CLARI Compliance Division, gave a really great presentation at the NACOP conference a few years ago. And in that, he said that there is a wide variety of ways that you can be audited. More often than not, what I find and what I hear from schools across the United States is that when they get audited, they are audited under a full financial aid Title IV program review or recertification. So that's when the Department of Ed folks come, they meet with your financial aid folks to make sure that everything is squared away with financial aid in terms of disbursement, in terms of reporting, those types of things. Often when they come to campus, they will look at a wide variety of other mandates that are connected with financial aid, and Drug-Free Schools and Campus Act is one of those. The second most common way of getting audited is through a CLARI compliance review. So when they come and they look at your CLARI compliance policy, when they look at your programs, those types of things, they'll typically also delve into the Drug-Free Schools and Campuses Act. And it's for that reason that I recommend that if you are the person on your campus responsible for Drug-Free Schools and Campuses Act, if you are responsible for the notice, if you're responsible for the biennial review report, if you're responsible for delivering and making sure that you have a comprehensive drug and alcohol prevention program, that you become best friends with the folks in financial aid on your campus, as well as your CLARI compliance officer. So that way, if they are notified that they are being audited for those things, that they will let you know, so that way you have some awareness and some time to prepare for that audit visit. In terms of violations, and these are 2016 findings, you will see a wide variety of schools. Some are state institutions, some are related to colleges of nursing, some are technical schools. What you will find is when it comes to auditing, they're looking at everyone. It is no longer just a 4-year institutional problem. It's just not a public institutional problem. They look at everyone, and what you will see is that there were some pretty what would be considered hefty fines for 2016. You will see that some schools got the maximum sanction fine of $35,000 for that time. A lot of schools in the upper 20s. Again, if you go to the previous slide where I had those links to the Clary Act and to the data center, you can go in and see what schools are currently being fined. In terms of consequences, if you end up getting audited, there was an Inflation Adjustment Act Improvements Act of 2015. What that did is that they moved the monetary penalty from $35,000 to just shy of $54,000. So this is actually related to both violations for the Drug-Free Schools and Campuses Act and Clary. So if they do end up coming and auditing your institution and you are found in violation for Drug-Free Schools and Campuses Act, you can expect up to a $54,000 penalty. So the stakes have gotten much, much higher than where we were in the past. Now, if you end up getting audited, what could happen and what seems to be the trend? More often than not, you will be put under a corrective action plan. They will highlight where you are in non-compliance, what it is that you need to do. When I look at the final program review findings, a lot of times there are schools that have not put out an annual notice. They have not distributed that annual notice to everybody within a 12-month period. They have not done a biannual review. So a lot of those corrective actions are basically saying, you have to do these things, you have to show us that you're doing these things, and you have to turn these things in. One of the things that I've heard from folks that I've talked to that have been audited is that usually if they come and audit one thing and something is wrong, it usually triggers audits in other areas. So if they come and they do audit your Title IV recertification and there's problems there, they're going to scrutinize a little bit more heavily across the board and look at other audits. Again, there is the possibility of fines and sanctions, which we have just talked about. And some of the things that I've learned is that if you are found in violation, your institution's name is given to your congressional representatives in Washington, D.C. There is a possible suspension or limitation of Title IV funding, but that doesn't seem to happen very much for drug-free schools. There is also possible negative media attention. And one of the other things that I have not thought about is that the lack of compliance, should you have an unfortunate incident at your campus that would involve alcohol and other substance use, that might be used in court to demonstrate indifference to campus security and alcohol and other drug issues. So there are a wide variety of reasons why to do this, and a lot of number of consequences that we would all hope to avoid. So up to this point in time, we've kind of talked about where we've been. We've talked about auditing. We've talked about the types of audits that may come up. I will revisit auditing at the end and provide some insights and some comments that those that have been audited that have shared with me. But for the main point at this point, I want to move into the main elements of the Drug-Free Schools and Campuses Act, and what that really means and what it expects and asks for us. But before I do that, I do want to take a minute to see if there are any questions related to any of the content that we have delivered at this point in time. So if you have any questions, please feel free to present those to us through the chat function and the question function. Okay, it doesn't appear as if anyone has any questions at this point in time, so we are going to go ahead and move into the main elements of the Drug-Free Schools and Campuses Act. The Drug-Free Schools and Campuses Act is commonly also called Edgar Part 86. And basically what this says is that the Drug-Free Schools and Campuses regs require that as a condition of receiving funds or any other form of financial assistance under any federal program, an institution of higher education must certify that it has adopted and implemented a program to prevent the unlawful possession, use, or distribution of illicit drugs and alcohol by students and employees. So we have to go through a certification process. We have to have a program that prevents unlawful possession, use, or distribution of illicit drugs. And illicit drugs would be defined as those drugs seen as illicit by the federal government. So when we look at the national climate, we see a lot of states that have decriminalized marijuana, for example. Many states have made medicinal marijuana acceptable, and others have gone through the process of legalization. That creates a dichotomy because you may have state legislatures saying things are good, things are okay. You may have local ordinances say things are good, things are okay, but federal law supersedes both state law and local ordinances. So in some aspect, this has not changed for us, but it does change the way that we operate. And later on in the presentation, I will also circle back and provide some thoughts and some information about how the Drug-Free Schools and Campuses Act is affected by the changes going on at the state and national level, as well as local level, and what it may mean for your campus. But again, we have to have these elements. So one of the questions I often get is, what does certification mean? Well, typically when the feds provide funding and assistance, an institution of higher education must certify compliance with a large number of things. So what many people don't realize is that when an institution agrees to take Title IV financial aid agreements with the Department of Ed, they are automatically agreeing to comply with CLARI. They're automatically agreeing to comply with the Drug-Free Schools and Campuses Act. And once that paperwork is signed and submitted, you've kind of indicated, yes, we are doing these things and we will do these things. One of the other things that I've learned is that in terms of some federal grants, within that paperwork, there may be an area called representations and certifications. And within that paperwork, the institution is also agreeing and certifying that it will comply with different mandates related to federal policy. So one of the things that I often like to tell folks is that in addition to becoming friends with financial aid and the CLARI compliance officer, find out on your campus who's in charge of research and sponsored programs, grant funding, figure out how much federal dollars are flowing through that office. And if there's anything more than a penny, make sure that those folks understand and are aware of your work in complying with the Drug-Free Schools and Campuses Act as well. One of the things that folks often ask me is, okay, once we certify that we're doing this, what else do we need to do? Well, in addition to the contracts that you have with the federal government, back in 1990, the slide that you're seeing now should say name of university/college at top, and you'll see Drug-Free Schools and Campuses Regs, Edgar Part 86, Alcohol and Other Drug Prevention Certification. In 1990, this particular document, this is a template that I've created for folks, was sent out to all institutions of higher ed, and the senior chief executive officer had to sign off on this and send this back to the Department of Ed. This is really the only time within the history of the Drug-Free Schools and Campuses Act that institutions had to uniformly and universally send something in to the Department of Ed. I recommend institutions to take a copy of this template, modify it for your institution, and get as high and as a senior level executive officer as you can get to sign off on this, and include this with your biennial review report. Because basically what you will see, it says that we have a program, that we annually distribute a notice, and that we conduct a biennial review. And again, I think the best place for this is with that biennial review report. And this should be one of the templates that are available in the handouts. It looks as if one of the handouts that we have provided is a PDF, and for some reason that PDF link is not working. Thank you, Scott, for bringing that to our attention. We will have email addresses of everybody who registered for this presentation. So once we get done with the presentation later on today or later on this week, we will send an email out to everybody who's on today with a copy of the PowerPoint, copies of these handouts, as well as some additional information that many of you can use. But as for the certificate, this is probably, again, what you see on the screen, the closest thing to a certificate that has ever been developed. And again, this was what was required of institutions in 1990. While we're talking about certification, Presidential Senior Administrator Certification, back in the days when the federal government had more money, the Department of Education actually had a National Higher Education Alcohol and Other Drug meeting. The last meeting that was held was in October 2010. And at that point in time, Norris Dickard, who was in charge of the office that oversaw the Safe and Drug-Free Schools program, he was on a panel. And one of the things that he said, and again, you will not find this written down anywhere. It is one of those storytelling narratives that came about. But during a panel discussion on the Safe and Drug-Free Schools and Campuses Act program, he said that institutions of higher ed must have the senior leading administrator, and for most of us, that would be our presidents, certify that we are doing those three things: that we have a program, that we're annually distributing a notice, and that we're having a biennial review minimally every 5 years. And if you have a new senior leading administrator, that leading administrator should certify within a short time frame of them assuming office. So again, on one hand, we're certifying when we recertify for Title IV. There's that document. But again, if you can get a senior leading administrator to certify and sign that document on a regular basis, that will probably strengthen your practice. I've mentioned it. So when we look at the minimum requirements are that we annually distribute a notification of a drug and alcohol prevention program notice, that we have a drug and alcohol prevention program, and we prepare a biennial review, and we have a report that looks at the effectiveness of our comprehensive alcohol and other drug programs and the consistency of policy enforcement. One of the interesting things that is coming out when we look at program review findings is that if you do not have anything that would resemble a program, you can't have a biennial review. And sometimes you will see that if an institution has failed on developing and disseminating a notice, even if you have other things that are going on related to alcohol prevention, sometimes they will say you still can't have the biennial review because you haven't done the notice. So it seems as if there is a scope and sequence to doing the Drug-Free Schools and Campuses Act. You have to have a program, you have to have a notice, and then you have to have a review of the program and the notice. So in some ways, it's kind of a hierarchy, a sequence through that. And again, that seems to be coming out more and more in program review findings. Which leads to some confusion, I think. One of the things that I would encourage you to think about and ask yourself is, how do you define what is a program and how do you define what is a notice? And some of the language that I've started encouraging everybody to use, and part of this will be upon you to look at what you have done in terms of documents, in terms of programs, is really delineate between a prevention program and a program notice. The program notice, which we'll talk about in a few slides, is the document that everybody should get at least once within every 12 months. Some institutions will say that comprises their program. My background is in health education, health promotion. I don't necessarily think of a notice as being a program, and I don't think of a program as just being a one-time thing. When we think about prevention, we really need to be thinking about best practices. We need to be thinking about evidence-based practice and what really seems to be most effective in today's age and time. And that's one of the challenges, and that's why earlier in the presentation, I said, what was prevention like in the 80s? Because we're 30 years beyond that. We know a lot more about prevention than we did back then. We know more about what's effective, what seems to work, and there is really it's really implied within the drug-free schools that we don't stay in the 80s, that we have evolved and have grown into really best practice and evidence-based prevention of today. So again, I encourage you to think about your prevention program as being something large and comprehensive, multifaceted, a lot of different working parts, and the program notice being one piece of that puzzle. Now, one of the questions that I always get asked is, okay, we have our drug and alcohol prevention program notice, we have our biennial review, and we've created a report summarizing that review, key findings, recommendations, data. What do we do with it? Where do we send it off? At this point in time, you do not send it away, you do not send it off unless someone from the Department of Education contacts you and asks you to do so. It stays on your campus. This is very different than Clary. With Clary, we have to upload our data, our statistics on an online platform. My understanding is that we also send hard copies off to somewhere within the Department of Ed. But with the Drug-Free Schools and Campuses Act, we really don't send it anywhere unless someone contacts us and says we need to send it off. And one of the things that I like to talk about when we think about the main elements of the Drug-Free Schools and Campuses Act is the letter of the law versus the spirit of the law. And again, as I alluded to a few minutes earlier, when we think about this particular mandate, we really are expected to uphold the spirit of the act, that we address substance issues based upon current research, evaluation, best practices, data, that our focus is on prevention. Prevention is somewhat of an ambiguous term, but a lot of our focus needs to be on primary prevention. I'll see a lot of schools that will have strong counseling intervention, and treatment programs. That is part of a comprehensive program, but we really need to be focusing on reducing issues before they begin. Excuse me while I take a drink of water. One of the other questions that I get is, okay, we have our notice, we have our biennial review, how long do we need to keep it? What is written within the drug-free schools and campus compliance book is that we need to keep records for 3 years after the fiscal year in which the record was created. So if you are working on your biennial review now, based upon best practice, you need to have that biennial review and a report associated with it completed by December 31st. We are now in fiscal year 19. That document would be created in fiscal year 19. So you would need to keep that document for fiscal year 20, fiscal year 21, fiscal year 22, based upon the federal guidelines. Being that you are a state system, I'm not necessarily certain what kinds of records retention policies that you have within New York, within the SUNY system. So if your records retention policies require you to keep your records for longer than 3 years, you would need to keep it longer for 3 years. But based upon the federal guidelines, at least 3 fiscal years after the fiscal year in which the document was created. In terms of records, you would need to keep a copy of your drug and alcohol prevention program notice, a copy of your certification, which is part of the reason why I offer that template that I've offered in the past. If you have a biennial review, your results, your findings, your recommendations, and then any other documentation that you may feel is related to your comprehensive program or that biennial review process. Typically, these are the documents that will be asked for if you are audited. It is also possible that if you are audited, they will ask for a wide variety of other documents. I've talked with some schools who have said they've been asked if they have survey results such as core results or National College Health Assessment results. I've had another colleague say that they were asked to submit some data on alcohol-related policy violation sanctions to show that one group of students were getting the same types of sanctions as another group of students. So there is some variance in what may be asked for, but it seems like the annually distributed drug and alcohol prevention program notice, the biennial review, are the 2 main documents that are often frequently asked for. So again, what do you do with your biennial review and your DayUp? They call it DayUp notice. You don't send it to anybody unless it's requested. Now, I do offer several recommendations. I will say take a hard copy of your biennial report, of your drug and alcohol prevention program notice, and make sure that a hard copy of that is sent to your president's office, as well as your senior student affairs officer's office. I also encourage those who are responsible for those 2 documents to make sure that a signed copy gets sent to financial aid, that a signed copy gets sent to your clery compliance officer, that you send a copy to your grants or research sponsored programs, and then the other places would be anywhere someone would think that this type of report would be obtained. So whether it's your health service, your health promotion office, your alcohol center, whoever is responsible for your alcohol program on your campus, if they're not involved in the development of these documents, they really need to have copies of those. Now, some schools have started placing their biennial reviews online. that seems to be acceptable, but it is not a requirement. There is nothing in the current book that says it has to be posted online, nor does it seem to be prevalent in any of the program review findings that say that it has to be online. That would be an institutional decision that you would make at this point in time. So before we go into the nuts and bolts of the annual notice, the biennial review, what is a program, what is not a program, I want to give an opportunity to you all to see if there are any questions regarding the core requirements of this act, as well as documentation and reporting. We do have some questions. I'd like to thank Rebecca Harrington. Her question is, if the content of the notice is included in a code of conduct, does that suffice? It could. I think what is probably more important is whether or not the content that is included in that notice within the code of conduct actually meets all of the requirements and all of the pieces that are required to be in that notice. One of the things that we will get into in a few moments as we talk about the notice are what are the elements that go into that notice. And I think what you will find is that if you were to sit down and include all of the content, it's going to be a rather lengthy notice by itself. So if it's also embedded within a code of conduct, it is going to greatly lengthen that code of conduct. The other question that I would have is, how is the code of conduct disseminated and distributed to students, staff, and faculty? Does everybody get that within a 1-year period? So as long as you are meeting the required expectations for conduct and you are meeting the expectations for dissemination, it's probably okay within a code of conduct. But again, it has to have certain content and it has to be getting out to everybody. Lori Reynolds has asked, does this occur with school districts as well, or just college campuses? The act that we're talking about today really just deals with college campuses. While I do have some work experience in a K-12 setting, that work experience is long before my college experience, so it's probably about 23, 24 years ago. And I'm just not been able to keep up with the K-12 requirements and what is expected of our K-12 districts. So this act and everything that I'm talking about really focuses on higher education. And I apologize, Lori, I just am not well informed as to the requirements for K-12 districts. Sarah has asked if we could go ahead and take a break. It's 9 o'clock. We've been at it for an hour. We are at a good point to be able to take a break. So I'm going to go ahead and take a 3 to 5 minute break, and then we're going to move into ensuring compliance and talking about the annual notice, what constitutes a program, and the biennial review. And I have just sent a notice to everybody saying that we will take a 3 to 5 minute break and reconvene at, oh, I mistyped, 10:05, not 10:15. For those of you who may be joining us, we are taking a short break. That way everyone can get up and stretch their legs for a few minutes. We do plan to reconvene in a few minutes. For those of you who may have just joined us, we are taking a short bathroom break, stretch break. We will be reconvening in a few minutes where we will begin talking about the Drug and Alcohol Prevention Program notice, what it entails, how it is to be distributed and disseminated, and those types of things. Okay, we are going to go ahead and reconvene. As I alluded to prior to the break, we're really going to start talking about ensuring compliance and looking at the different parts of the mandate. And the part that we are going to be looking at will be, for the next several minutes, will be the annual notification. But before I do that, I do want to look at one of our questions. The question is, in the recordings or information we obtain after the webinar, will we be getting a copy of the slideshow itself? I like to put notes right with the slides when possible. Yes, I will be distributing a copy of the slide deck. We had some challenges getting it uploaded as one of the handouts based upon the size, and we just didn't have time to PDF it to narrow the size down, but we will be sending out a copy of the slide deck to everybody who's registered as well. But moving on and talking about annual notification, one of the things that I like to start out with is that the notification that we have to do for Drug-Free Schools and Campuses Act is not the same as the notice for the Clary Act. I've had some interactions with some schools where they have mistaken the two as being one, and they really are two very separate and distinct notices. One of the frustrations with the Drug-Free Schools and Campuses Act in comparison to the Clary Act is that Clary tends to be much more specific, much more prescribed, and much more definitive. If you look at the guidance that we get from the Department of Ed, they give us a document that when it's printed out is several hundred pages long and is very detailed, highly prescriptive, and tells you exactly and what it is that you need to do. The Drug-Free Schools and Campuses Act guide has not been revised in over 12 years. It tends to be a little bit more vague. It tends to be a little bit more ambiguous. But one of the things that I will sit there and say is when it comes down to the Drug-Free Schools and Campuses Act Drug and Alcohol Prevention Program notice, is that they do tell us and prescribe to us what needs to be in that notice. And what I find a lot of times is if a school has a drug and alcohol prevention program notice that is less than 2 pages in length, it's probably not including everything that needs to be in that notice. If it is just a paragraph, it is definitely not including everything that is required in that notice. So when we go, well, what do we have to do? Well, one of the first things that I would say with this notice is that you're probably not distributing it or sending it out enough. With Clary, the guidance that we typically get is you send it out before October 1st, which is the beginning of the federal year. You look at everybody who is on your roster at that point in time, and you send it out. The way that the Drug-Free Schools and Campuses Act notice says is that notification must occur annually within a 12-month period to each employee and student. And what you will see on this slide in the white box is actually a screen capture of text that is very common in a program review finding. And it says the distribution plan must make provisions for providing the drug and alcohol prevention program disclosure annually to students who enroll at a date after the initial distribution and for employees who are hired at different points throughout the year. So you may have your main distribution sent out in the fall. And that's great, and that's good, and that's grand. But the question then becomes, how do the students who join your institution after the fall semester get their notice within that 12-year period? Likewise, if you have employees who join your institution after your annual dissemination, how do those new employees get the drug and alcohol prevention program notice? So it may be that not only do you have to do it once, but you may have to distribute it several different times throughout the year to make sure that you catch everybody who has joined your institution after your primary method of distribution. And again, that's a little bit different than clearing. When we look at the Drug and Alcohol Prevention Program notice, there are 5 areas that notice should include. It should include some information on standards of conduct. You should have a section looking at applicable federal laws, state laws, local laws, as well as institutional policies and sanctions that are connected to violating those laws and those policies. A section on short-term and long-term health risk associated with different drugs. A listing of your alcohol and other drug prevention and treatment programs that are available to your students, staff, and faculty, and a clear statement that your institution will impose disciplinary statements. Now, one of the key concepts that I want to hit home is that this notification, this disclosure, goes to everybody, students, staff, and faculty. What I see a lot of times if there is an institution that is in violation is that they're doing a really great job of making sure that their students get this document. But the only time that their employees get the document is when they're new and they go through orientation. This really needs to be sent out to everybody on your campus. Everybody needs to get it at least once within a 12-month period. And again, this information should apply across the board to everybody, not necessarily just students. Now, when we look at standards of conduct, the standards of conduct that you have for alcohol and other drugs should cover all students who are registered for any course at your institution where they get any type of academic credit. When these regs were written, the exception to this rule would be if you had students on your campus who were getting continuing education. Higher education has evolved. Back when these regulations were written at Eastern Illinois University, we considered students falling into 1 or 2 groups. On campus versus continuing ed. If you were in a class where your rear end was in a seat, you were considered to be on campus. Continuing ed were really correspondence courses or those courses that occurred off campus, maybe held at a community college, maybe held in a cohort, those types of things. Over 20 years, courses on my campus have evolved greatly. We still have our traditional courses. We still have continuing ed courses that meet off campus. We have online courses. We have hybrid courses. We have started doing dual credit programs at our institution where we have high school students at high schools several dozens, if not hundreds of miles away. They're taking a high school class and getting college credit for it. Those students are getting college credit. So one of the questions that I have started to ask myself is, how do those high school students, for example, get this notice? How do I assure that this notice is being disseminated to them? So one of the things that I encourage institutions at this point in time is really take a look at the types of courses that you are offering, look at the programs that you are offering, and make sure that those students who are getting any type of academic credit outside of continuing ed are getting this notice. And a lot of times those are groups that fall between the cracks. You probably haven't thought about, oh, do we need to make sure that the students who are in a dual credit program, who are basically at a high school miles away, are they getting this notice? It may be easier for you to get the notice to them, but again, it is something that has to be done. In terms of standards of conduct, you probably also have students who work for you at your institution. So those students may not only be having to abide by student policies, but there may also be employment policies related to substance abuse that they also have to abide by. The biggest thing that I can think of is the safe and drug-free workplace requires that if you have an employee that has a criminal prosecution for an alcohol or drug violation, there's a certain amount of time in which that has to be reported to the federal government. And as I think about it, I wonder how many institutions are taking those student off-campus violations and prosecutions and providing that notice as part of the safe and drug-free workplace. The standards of conduct applies to all on-campus activities. And again, what is an on-campus activity? It may be what you consider your main campus. If you have a cohort that is renting space at a community college or some other institution that is away from your main campus, or if you have a secondary campus, that would probably be considered an on-campus activity, as well as off-campus activities officially sponsored by institutions of higher ed. So one of the things that I often recommend is if you've not reviewed your campus policies and practices regarding what is defined as an official activity, what is not an official activity, that may be something important to do. It has also been interpreted to apply to student-sponsored social activities and professional meetings attended by employees. So if you go to a conference, even if you go to Colorado, where marijuana is legalized and it's after the conference area, you are still there on work time. You are there as a representative of the institution. And besides being outlawed by federal law, you know, the codes of standard and conduct should still apply to you at that point in time as well. And you should not be using recreational marijuana. Legal sanctions. You should include a description of the applicable legal sanctions under local, state, or federal law for the unlawful possession or distribution of illicit drugs and alcohol. This is one of the sections that really creates a lot of length in your policy notice. Especially if you are looking at both the federal and state sanctions. If you are adding tables, if you're adding charts, it's going to add a great deal of length to the policy. And that's where I say that it can't be less than 2 pages, especially if you're covering several different federal laws and state laws. And then you also need to be including your campus policies as well as the sanctions that typically occur if a student violates policy on your campus. Somewhere within that statement, it should also state that, you know, if you violate the policy, you may be subject to both the institutional sanctions as well as criminal sanctions. This tends to be more of a preference of institutions. Some institutions will, you know, say if you're off campus and you violate a policy off campus and you have to go to the local courts, or you violated a state law and you have to go to the courts, we're not going to engage in double jeopardy and you know, consecrate you for something you've already been consecrated for. Other campuses will do both. Whatever your policy and practice is at your institution, you really need to make sure that that's kind of clearly defined, but also realize that it can occur in both situations. Health risk. This is one of the more interesting areas. We are to put within the notice a description of the health risk associated with the illicit drugs and abuse of alcohol that occurs on your campus. Along with that, statement of health risk associated with alcohol and other drugs represent the minimal level of information that you must distribute. So you've got to include this in your notice. So going back to Rebecca's question of, you know, is this notice in the code of conduct? You have to make sure that you have some information related to health risk of various different substances. And if that is not within the code of conduct, you're not meeting the requirements that have been set by the Department of Ed. A lot of times I'll be asked, well, what should the health risk include? I often recommend that you include whether or not there is a risk of dependence of that drug. Is it a physically dependent drug? Is it a psychologically dependent drug? What are some of the possible short-term effects of using that drug? What are the possible long-term effects of using that drug? And is there a possibility of overdose from that particular substance? Now, a lot of schools that I have worked with and seen use a shotgun approach and just list common categories of drugs. And they use that list year after year with relatively little change once they've created it. One of the things that I would like to suggest and ask you to think about is this list is supposed to be a list of drugs that are used by your students on your campus. In some ways, this list is your institution's acknowledgement that these are the drugs of choice, these are the drugs of use that occur on your campus. So one of the questions I often like to ask schools is, well, how do you know what drugs are actually being used on your campus? What data do you have that supports that these are the drugs of use, that these are the drugs of choice on your campus? And how timely is this list? So if you're collecting data, if you have a variety of data collection points, whether it's a survey, whether it's policy violations, whether it's residential conduct reports, you have some inkling of being able to say, these are the drugs that are used on our campus. Because really this list implies that these are the drugs that are being used. And I think it's important for institutions to kind of review and revisit the list of drugs, because we know that drug culture changes. We know that a drug that may have been common 4 or 5 years ago may be less common currently. And it may be one of those things where you can sit there and say, we're going to put the main drugs, we're going to put the main drug categories. It may be the part where you can save some space in writing and developing this document, especially if you've got drugs that you have no proof or evidence that are being used in your campus or your campus community. We're also to include in the notice a listing of drug and alcohol programs. And when we think of a comprehensive program, we're really looking at the scope of care. So probably a description of our prevention programs. If our campuses have any form of formal intervention programs, assessment and identification programs, those should be included as a description. What treatment is available to our students, staff, and faculty. Are there options for rehab? And one of the new areas that I see coming up within the program review findings is what services, what programs, what options do we have for students who are in recovery, who have gone through treatment as they are beginning to re-enter back into our campuses. That is a new area, and I think we're seeing more and more attention being focused on that with the recovery movement that we see in a lot of our college campus communities. So again, a description of kind of your scope of care of what your campus has to offer. You may have a small campus and you may not have counseling, but are there options for your students to obtain counseling in the community or in the region if you do not have that service? I encourage you to think hard about some criteria that you would use if you are including off-campus entities, particularly for treatment. We had a situation where in our community, we have a long-standing substance abuse treatment agency. They've been around forever. They're well known in the community. We would definitely put them as a treatment option for our students, staff, and faculty. But over time, several other agencies developed within our community that offered substance abuse counseling. We were able to catch most of them. There was one that we didn't catch. That agency got its feelings hurt and said, well, why aren't we on this list? So then we, put that agency on the list. And then we had a lot of counselors and social workers that basically had independent practice. They were seeing patients independently. They weren't part of an agency, and they wanted to be on the reference list. And we finally had to develop some criteria saying you must be an agency, you must be licensed through the state. So that way we wouldn't necessarily have to put down every single counselor that practiced within Coles County. The last portion of the notice would be disciplinary sanctions. And again, a clear statement that you will impose sanctions on students, employees that is consistent with local, state, and federal law, and a description of those sanctions up to and including expulsion and termination of employment and referral for prosecution. So again, it's not enough just to list the laws and policies, but really what are the sanctions? I recommend that institutions put in typical sanctions. As an educator, I always hated it when we would go out and we would do programs and we would say, if you do wrong, this is what's going to happen to you. And we gave the worst possible scenario, because invariably it didn't matter when I was doing community-based prevention or if I was doing college-based prevention. If I would sit there and say, the worst thing that can happen to you is X, students would come up and say, well, my friend did that and they never got X. They never got hammered for X. They always got Y and Z, but they never got X. So I encourage you to think about what are the sanctions that you typically employ on your campus? What are the sanctions that are typically employed in your community for off-campus violations? And really put down what students can typically expect to receive. And stress that maybe more than what the worst possible case scenario could be. You want to list the worst case scenario, but really provide the range or the menu of sanctioning options and really hit home what typically will happen. Now, when it comes to disciplinary sanction enforcement, there is nothing within the Act that says who is responsible for employing sanctions for violations that occur on your campus or off campus. And I think the philosophical approach, and I think what is typically best practice, is that this is a shared practice on many campuses. You will have multiple units, multiple departments involved, whether it be campus police, campus security, residence life, dean of students, judicial affairs, health and counseling services, students, if you have a student facilitated conduct panel. So again, a lot of different hands involved with this. And I'm going to make the assumption that on your campus, you have developed a process and protocols that seem to fit your unique campus characteristics and culture. We've talked about what goes in the notice. Let's talk a little bit about how to get the notice out. Again, we've covered that everybody has to get it at least once. And the way that the regulations are written is that every student, staff, and faculty member has to get it in writing. Historically, this has probably been one of the more difficult aspects of the Drug-Free Schools and Campuses Act. When the act came out in the 80s, you have to think about where we were with technology. And the expectation was that you would deliver a hard copy to each and every student, staff, and faculty within a 12-month period. Once we moved forward with technology, a lot of people were asking questions. Can you send it in email? And if any of you have had an opportunity to hear me previously, up till about 12 months ago, what you would have heard me say is, if you wish as an institution to send this policy out electronically by email, you have to have established on your campus a policy that says official notices will be sent out by email. You have to have a mechanism that would assure that a majority of people that you're sending those emails out to actually are getting the email, opening it up, and seeing it. And then everything that you have in that policy notice, the entire policy notice, would have to be put into the body of the email. A lot of campuses would say, can we just put a link in the body of the email directing students, staff, and faculty to a website that would have the notice? And up to about 12 months ago, I would have said, based upon the guidance that we've been given, the answer is no. You have to include everything in the body. But there was an institution that had non-compliance, and in their program review findings report, it basically said that you could go ahead, provide a brief introduction that, we're required to provide you with this notice. This notice can be found online and that would suffice as your notice. So again, it's a different policy change, which probably many institutions will greatly appreciate. And speaking of which, you will see that on this slide. The program review determination is from Occidental College, and what you will see it say is that an institution may distribute the annual disclosure by electronic mail if it wishes to do so. The method for such a distribution would require the institution to post program materials on its website and then send an email message to each mandatory recipient that includes a direct link to the document. What you will see is sending a general email message to students and employees, encourage them to read all of the college policies, does not meet the standard for direct notice. So going back to Rebecca's question of, can we include it in the student conduct? I'm aware that some schools do that. Some institutions will send out multiple policies within one document. That may be kind of iffy depending upon the auditor, but you just can't send an email saying all of your policies can be found in your student handbook, please read them. You have to send a separate and distinct notice that says, we're required to give you the Drug-Free Schools and Campuses Act Drug and Alcohol Prevention Program notice. That notice is found here, and then direct them to that. One of the questions that I often get is, can we use multiple means of sending out the notice? And the answer to that is yes. Some schools that I'm aware of will have a slightly different notice for faculty and staff than what they send out to students. As long as you have those major elements included in the notice, that is okay. But I think what is really important more than anything else is that your dissemination and distribution be active. It cannot be passive. Some schools have gotten in trouble because they will take copies of their drug and alcohol prevention program notice and they will just put it on a table at orientation. That is a great secondary method. I encourage getting it out as many methods as possible, but you cannot use that just putting it out on a table and having people pick it up if they see fit as your primary method of distribution. It is too passive. You've got to really have an active method of getting that distribution out. In the past, Back when snail mail was more commonly used, the department was able to provide a much better guidance as to what we should do in terms of distributing it. So, sorry, excuse me. So for those of you that may be distributing it for some time, you may have used the US mail system, you may have used your campus mail system, you may have disseminated through academic advising, you may have put in letters that went out regarding financial aid, you may have put in with paychecks, W-2 forms. If you're still doing those things, those things are still good and acceptable. The real question becomes, if you're sending out electronically, what happens if a bunch of the emails aren't opened up? Students aren't getting it. You have no way of checking that. You may want to reconsider electronic distribution. You've got to do everything possible to ensure that it's getting it. Students are getting it. In the old days, if we were sending out by snail mail and it came back to us because the student had moved or relocated, we would be expected to get a new address and resend it to the student until it quit coming back. Email and other electronic distribution methods may not be able to allow us to do that. I know when email came up and a lot of schools were asking about it, one of the questions that folks had, well, what about the return receipt mechanism? And that's acceptable, but many of us know that you can get an email, hit the button that basically doesn't send the return receipt back. So then the person who has sent us that email really doesn't know whether we opened it or not. So again, if you're thinking about electronic distribution, it really is a conversation that you need to have on your campus with a bunch of people, your IT people, to see if you really have the capacity to be able to do it, and if the culture on your campus is that students, staff, and faculty really are checking their email and those types of things. One of the questions that Rebecca is asking is defining receipt. Does a box need to be checked or just proof that it reached someone's inbox? Again, it's kind of muddy because the department has not given any actual advice or guidance outside of that one statement that I found in the Occidental College program review finding. In 2010, at that national panel, they were basically saying to schools, you need to have the policy, you need to be able to assure that a majority of the majority, clearly 90% or greater, were actually accessing and getting emails from the email system. And you wouldn't necessarily need a receipt or a check. On my campus, what we have done is we have gone through our portal. We have a portal that all students, staff, and faculty access. And we have set up the portal that after a particular date, the policy pops up. It indicates that it's the Drug and Alcohol Prevention Program notice that's required by the Safe and Drug-Free Schools Act. And at the bottom, we actually have I have received and I have read the policy. People have to check the box, and they have to do that to be able to move further in the portal, to be able to access the things that they would typically access in the portal, like grades, class rosters, submit time, report time, those types of things. That seems to work very well for us. And then for us, what's really nice about it is if we have one of those late comers to the institution, students who are registering for spring semester, or we have a new employee, the system is automatically set up that the first time you log into the system, that pops up, and it continues to pop up until you've checked that box. It's a great question, Rebecca. I know I've kind of danced around it, but that's the best that I can answer, and I will look into seeing if I can find a more definitive answer. Another question by Stacy is, what is your recommendation or thoughts on third-party vendors who work on your campus? Great question. I know for many of other laws and requirements on our campus, we require our third-party vendors to have that information as well. So I would encourage your institutions to send that notice to third-party vendors. It's probably the safest thing to do, just to make sure that they get that information. One of the questions from Bridget Bradish is, which office on campus is responsible for distributing this info, and is it the same department for students and employees? It varies from campus to campus. And this is one of the differences between the Clary Act and the Drug-Free Schools and Campuses Act. Clary Act requires that the institution have a Clary compliance officer. At this point in time, there is nothing in the regulations that require a Drug-Free Schools and Campuses Act compliance officer. But if you look at the program review findings, as well as when I went to the NACOP conference and heard Jim Moore speak, Jim Moore, the director of the Clary Compliance Division, strongly recommends that each institution name a person and assign that person responsibility for being the Drug-Free Schools and Campuses Act compliance officer. Who that person should be, which office should it be? I've seen a lot of different models. On many campuses, the office who is responsible for overseeing the comprehensive prevention program could be responsible. Other campuses, it's been the Clary compliance officer. On some campuses, it's been the president's office. There are a lot of different models out there. I think what is important is that a unit or a person be designated and that be publicly communicated to campus. I've seen on a number of campuses that Eric was responsible for the Drug-Free Schools and Campuses Act and doing the biennial review. It was seen as an additional duty as assigned, but it wasn't formally clarified, and then Eric leaves the institution. If the new Eric comes in and doesn't know that it's their responsibility, it falls between the cracks. I have also seen campuses where HR was responsible for sending out the policy notice. Another unit was assumed to be responsible for the program notice, and those units did not communicate. And then over time, HR let the notice go, and then, luckily I did a consultation visit and the schools were like, oh, we need to be doing this. But what ended up happening is the buck kept getting passed. This office is responsible for it. That office is responsible for it. I recommend a task force or a coalition approach. Even if one office or one person is responsible, I think that this is an institutional process. It shouldn't belong just to one person or one unit. It really needs to be a party of folks, a party of offices, especially when it comes to the biennial review, because you're going to be collecting a lot of different information. So sorry, Bridget, I don't have a clearly defined, clear-cut answer for you. Regarding who's responsible. It really depends upon your campus culture. And as for the same department for students and employees, it really depends upon if you're sending out one notice to everybody, or if you're sending a notice to the students, which is separate and distinct and different from the notice that's sent to faculty or staff. I have seen campuses do that, and that seemed to work well for them as well. Before I move on to talking about what is a program and what a program may mean, again, I would just reiterate, when it comes to the drug and alcohol prevention program notice or disclosure, have multiple ways of distributing and disseminating it. Figure out what your primary method is that you will use to be in compliance with the mandate. But then if there are other opportunities for you to share that policy, whether it be through new student orientation, whether it be online, you're never going to get in trouble for over disseminating this notice. It will probably be viewed very highly, but you just have to remember whatever method you are using as your primary method, that every student, staff, and faculty is getting it at least once within a 12-year period, and that notice contains all of the elements that are required to be in that notice. Before we move on to talking about what is meant by program, are there any other questions that any of you have regarding the annual notification? It doesn't look like we have any additional questions, so we're going to go ahead and move forward. Oh, before we move forward, Danielle has asked, health risks are generalized, but sounds like by class is recommended. I think so. One of the documents that I will send you that you may be able to open up under the handouts is an IHEC suggested DFSCA annual notification template. So for those of you that, sorry about my phone. For those of you that, may not have an annual notice that you've been using or one that you're happy with, we've developed this template for schools in Illinois. So you'll see a lot of Illinois laws, but it may be something that you can look at and take at and modify. And again, we have it in a Word document, so that way you can copy and paste and cut and paste to tailor your own. Moving forward, what is meant by a program? When these regs were created in the late 80s, our legislators had the foresight to realize that they did not have enough money to fund this program nationally. So on one hand, they kept it very vague and ambiguous, thinking that campuses would be able to figure out what would be best for them. So there's really not clear notice given. And as I said earlier, some campuses will interpret that the annual disclosure notice constitutes the program and really just do that. And that the biennial review and the notice constitute the program. And again, I think it goes back to where we have to look at what is the spirit of the law versus the letter of the law. And if we look at the spirit of the law, we really look at best practices in science of prevention, and really where the field is and where it's going, and really have to catch up. And Mary Ann asked a great question that I'll embed at this point. When this act was created, there was a real strong focus on prevention, a real strong focus on policy. But if we look at where we have come from and where we're at, we're now entering this period where there is a strong focus on recovery programs and recovery communities. And that is a rather new concept. And I think what you will see is, even though it is not written within the letter of the law that we focus on recovery programs and that we have recovery programs. I think that there will be this expectation based upon the spirit of the law that we begin moving forward and developing recovery communities on our campus. And I think it's important, for everyone to know that we do value recovery, that we encourage campuses to develop those services and programs, and that depending upon funding from the federal government and funding from your state, that there may be other revenue and funding sources that would allow us to complement the recovery program. I know one of the challenges that I have is recovery program a treatment function? Is it a prevention function? I think it could be argued that it could be either way. When we look at SAMHSA and how SAMHSA is divided into their centers, I'm hoping that down the road we will see additional monies coming from the treatment side of the fence that focus on recovery. But again, the regulations really do not define what a program is. And even if it were to define what a program is, I think we have to realize that these regulations really are over 30 years old. There are some standards of practice. There are some structures out there that I would encourage the viewers and the listeners to think about in terms of what a program is. The Department of Education actually has a set of principles of program effectiveness. These were basically created after the Department of Ed had funded several college-based prevention initiatives for alcohol in the late 1990s, early 2000s. And really, when you look at the 4 criteria, it makes a lot of sense, and it really folds in well with the requirements for the Drug-Free Schools and Campuses Act. And one is that we have data that we base our decisions on, that we're collecting information, that we're collecting numbers, that we're collecting statistics to really tell us what kind of problems exist on our campus, the magnitude of those problems, what our strengths are, what our weaknesses are. That if we have a prevention program, that we have some program goals, that we have some objectives, that we actually have a direction that we're headed, that we're just not bouncing around in the ocean of college life doing prevention based upon what we think is right, what we like to do, what our specialty is as a health educator, but we actually have, a clear strategic direction that we're headed in. That the things that we're doing are evidence-based, that they're evidence-informed, that they're best practiced, and then that we are also evaluating what we're doing in terms of programs, interventions, and policies, especially how they relate to the goals and objectives that we have set for our comprehensive program. So just looking at this slide alone, there is a wealth of information that we should be using as a foundation for our substance abuse prevention programming. If we look at the Drug and Alcohol Prevention Program notice, again, there is a scope of care. So we're looking at prevention, we're looking at assessment, we're looking at intervention, we're looking at treatment, we're looking at rehab, we're looking at reentry and recovery programs. So even from the point of the notice, there is some guidance there of what a comprehensive program might look like and the different elements that it would contain. Now, personally, out of all the standards and all of the frameworks that have been offered over the years, the one that I like the best is from the network of colleges and universities committed to the elimination of drug and alcohol abuse standards. This was a voluntary membership organization that was created in the late 80s. It aligned well with all the work that the Department of Education was doing. And what it really consisted of is if you were at an institution and you were doing prevention and you agreed to abide by these standards, your institution would voluntarily agree, sign some paperwork saying, yes, we promise to do these things. and then you were a member of the network. And on this slide, you will see a URL link that will take you to a document that really kind of set the preliminary standards for this network. Over time, those network standards did evolve and change. And what you will see is that one of the areas that existed was dealing with policy. So you would put out policy annually, i.e. this would be your drug and alcohol prevention program notice. You would look at policies that looked at individual behavior and group activities. You would define policy that would include all of your campus property. So looking at what it would be considered an official event, an unofficial event, many of the things that we talked about regarding that annual notification. You might also have policies that talked about marketing guidelines and hosting on and off campus events, which might include alcohol, as well as state institutional commitment to education and development. So many of the things that we are required to do for Drug-Free Schools and Campuses Act regarding the DayUp are all within that standard. Another standard that they had was education and student assistance. So this is where we really look at our prevention programming. We look at our alcohol-free programming. We look at training students, staff, and faculty, how to detect problems and signs and symptoms, how we're providing information to students, staff, faculty, and families, how we are enmeshing alcohol information into the curriculum. Basically, this is where we look at our educational plan, our prevention program, and our interventions. Another standard within the networks was enforcement. So, how did we promote and publicize our policies? How did we consistently enforce our policies? What were the sanctions for those policies regarding any violation for alcohol and other drug information, behavior, sorry. Another standard was assessment. And a lot of times when I've given this talk and talked to folks, people automatically jump to clinical assessment and diagnosis. This is really more community-based needs assessment, that you are collecting data from across the institution, possibly outside of your institution. You're looking at student behaviors, you're looking at awareness, beliefs, attitudes. You're getting data from your police, you're getting data from your housing system, perhaps your counseling system, your health service, maybe the ER down the street or your local EMS. You're basically collecting data and putting those pieces together like a jigsaw puzzle to figure out what your climate, your culture really look like. And then the last standard, which was added in 2010, is community collaboration. That there are groups of individuals and groups of offices, both on and off campus, that are working to address this issue. I like to think of coalition building as a bicycle wheel. If you have a bicycle wheel and you have some spokes that are broken, that wheel is not going to work very well over time. It's going to bend. It's going to affect the operations of the bike. You want as many spokes as possible to add strength to the wheel, and every spoke represents a different audience or different constituency that has a say at the table regarding the addressing of alcohol and other drug issues on your campus. So again, I really like the network standards. The sad part is that the network is no longer functioning. Over time, the Department of Ed was unable to provide funding for it for a variety of reasons. It really took a grassroots effort, and the leadership of that group just couldn't sustain it. So while that organization is no longer really with us, there is some work by the Higher Education Center out of Ohio State that is doing some work looking at state systems. And I figured ultimately this will probably become part of that process. For those of you that may belong to a health service or a medical clinic, you may be familiar with the American College Health Association. That association also has a set of standards for practice within health promotion within higher education that talks about aligning to the institutional mission, that you not only focus on individual interventions and group interventions, but you're really looking at the social ecology of the campus, that health promotion is a collaborative practice. It's just not the health promotion office that does the work. It really entwines many entities and many constituencies across the campus that interventions and programs are culturally competent and look at the particular culture of the students on your campus, as well as the different referent groups. We know that Greek life has a slightly different culture than perhaps the chess club, that our practice is theory-based and evidence-informed, and then those people who are responsible for implementing the practice are well-trained, have professional development, and really kind of have an idea of what it is that they're doing. Those of you within student affairs may be familiar with the Council for the Advancement of Standards. For those of you who don't, this organization has created sets of standards for approximately 40 different functional areas. So within the realm of substance abuse, there's actually an alcohol and tobacco functional area, there's a counseling functional area, a health promotion functional area, a health service functional area. My understanding is that there is also a new functional area that really is kind of a collaborative process, looking at many different offices that deal with serious behavioral issues that will be coming out. So again, a lot of different standards, and what you'll see is that each functional area standards looks at things such as mission, learning outcomes, resources, ethics, technology, finances, a great self-study process for those of you not familiar with CAS. But again, it sets up another set of standards that might be employed to help you define and create what your program is, as well as develop some mechanisms for coming about and measuring success and effectiveness. The Department of Ed in the late 90s and early 2000s had several competitive grant process programs. And through those competitive programs, they developed their own set of elements and characteristics of effective collegiate substance abuse prevention programs. You will see the slide is called Experiences in Effective Prevention. That is a title of a document that provided a summary of 22 campus-based model programs from '99 to 2004. And from that document, you will see that those programs that were effective and successful had leadership that was defined and exercised. So going back to our question earlier of who's in charge of the Drug-Free Schools and Campuses Act, who's in charge of the Drug and Alcohol Prevention Program Notice, who's in charge of the Drug and Alcohol Prevention Program, who is responsible for the leadership of substance abuse issues on your campus, and has that been institutionalized as a campus issue, not just the issue of one office? If it is the issue of one office, how does that one office provide leadership to the rest of campus and get people bought in? Which ties to the next bullet point. Coalitions. Again, it shouldn't belong to just one person or one office. It really should be institutionally owned, and a coalition or a task force really seemed to help those schools that were effective move their work down the road. Evidence-based programs, strategic planning, program evaluation, a plan towards sustainability, so that way when these grants ended, the institutions could continue on with their program, and then also taking the long view. They just weren't focused on the here and now. They were looking at, a few years down the road, 10 years down the road, realizing that sometimes changing culture related to substance abuse does not happen overnight. A real great document. I believe this document is now available. You can probably go to Google and put Experiences in Effective Prevention, U.S. Department of Ed, and I think you would be able to find it. The Department of Ed continued with their grant fund program. They came out with another document called Field Experiences in Effective Prevention that focused on 12 campus-based prevention programs. And like the first document, you'll see some similarities. They really linked prevention to the institution's missions, values, and priorities. Strategic planning was an important process of the grant. They looked at data. A little bit different than the first document is that students were involved. So as you're thinking about Drug-Free Schools and Campuses Act, you're thinking about the notice, you're thinking about your prevention program. How are students involved with those processes? How are students involved in the delivery, the planning, the decision making? What investment do students have? They found that getting students involved really helped them move their prevention programs further. One of the other things was that paying attention to strategic timing. On your campuses, you probably know that there are certain weekends, certain weeks where drinking and drug use tend to be much higher than other weeks. Are you paying any attention to that timing and delivering programs during those strategic times and prior to those strategic times where alcohol and drug use is likely to be increased and raised? And then one of the other aspects is communication skills. These 12 schools that were found to be highly effective were doing really well communicating what they were doing to campus and community. They were employing social marketing. They were employing marketing campaigns. They were just really maximizing communication skills during this time period. So again, another framework, another idea of when you create your campus prevention program, or when you look at your campus prevention program, you can look and see, well, how does our program fare to these types of things? It will probably reinforce several things that you're doing well, as well as some areas that you may wish to improve upon. The last area that I would talk about in terms of a program, and if you're a practitioner, you're probably familiar with this. If you're not a direct line practitioner, if substance abuse is another duty is assigned, or it's something that you involve yourself with, but it's probably not a primary job function of yours. This may be new for those of you whose substance abuse is a primary job function. This may be a little bit of review, but evidence-based programming and strategies. A long time ago, it seems like a long time ago, but it was probably less than about 15 years, the NIAAA came out with a document, and they provided some evidence as to what was effective and what was not effective. And we operated under a tier system. For the sake of time, that tier system was viewed as obsolete, and the NIAAA came out with what they refer to as the College Alcohol Intervention Matrix. And basically they made this move because they felt that while the information that they had presented years earlier was good and solid, a lot of institutions were not adopting it. A lot of institutions were not utilizing it. And they wanted to provide some research that would allow institutions to really look at the problem on their campus related to alcohol and other drug use, and really employ some interventions and some strategies that might help them move their campuses forward. So they convened a group. They looked at all the research that was out there, looking at alcohol interventions, looking at policies, looking at social ecological interventions. And in the fall of 2015, they released this College Alcohol Intervention Matrix. And what they ended up doing is they divided interventions into one of two groups: individual level strategies or environmental level strategies. Things that would work best trying to create a change in individuals, things that would work best trying to create a change in the environment that would then impact individuals. And from their work, the slide that you see in front of you is the College AIM website, and you will see two tabs. One's individual strategies, one's environmental strategies. If you were to click one of those tabs, well, before we get to there, I've flipped some slides around. Strategies. What this will do is it will give you information on strategies based upon how much a strategy would cost, how effective the strategy is, what are some of the barriers to implement that strategy, and whether or not there's research available to support the use of those strategies. What you will see is when you go into that website, it will list the ratings, it will give you staffing needs, target populations. So really, as a tool, it will allow you to look at the things that you're doing, things that you might be considering doing, things that you've never considered doing, and give you an idea of how to move your comprehensive prevention program forward, particularly when it comes to individual strategies as well as environmental strategies. The slide that you see in front of you now is what happens if you click the environmental strategy link. And what you will see is you will see a matrix. The matrix has 3 columns. Left to right is based upon cost. So you will see lower cost interventions to your left, higher cost interventions to your right. And as you move down the column, you will start with those things that have a higher rating of effectiveness, moving down to things that have moderate or low effectiveness, or things that just do not have enough research that has been applied to addressing college alcohol use to deem whether or not it's effective. If you end up clicking on one of these things, interventions, you will see a box that comes up that describes the intervention. And again, those things that I alluded to in terms of effectiveness, cost, barriers, research amount, public health reach, those items are brought up to give you a summary of how that intervention may work and what may be needed to make the intervention work. And then down at the bottom of the box, you'll see some boxes that say summary notes, references, potential resources. If you click on those, it will provide you with some additional information. If you do the references, it will provide you with links to the journal articles that were used. You can use this as a needs assessment tool. You can use it to view what you're doing to determine whether it's good prevention or if you have a gap between where you are and where you want to be. It may also help you identify some populations of your campus that you may need to work with. The nice thing about the College AIM is that it does come with a worksheet tool. So what you'll see on the screen currently, it says strategic planning worksheet. The top half is really to list those things that you're doing now, whether or not it's an individual or an environmental intervention, the level of effectiveness, the cost, the barriers, whether it reaches a broad population or a focused population. It allows you to take some notes. And then if there are some other interventions or strategies that you have identified within the College AIM that you would like to possibly implement, you can list that as well on the worksheet. My belief is that you can use the College AIM as part of your biennial review process to figure out where you're at, where you want to go, and it provides a great strategic planning worksheet to include those areas that you want to move forward in during the next biennium. With that, we're going to go ahead and I'm going to grab some water because you can tell my voice is getting kind of scratchy. I'm also going to review some of the questions to make sure that I have not missed anything. And trying to decide whether to take the phone call or not. I'm going to look at questions. And we'll see if there's anything that we have missed. Julia asked, who do you notify if an employee's background check has a drug or alcohol infraction? Who do you notify if an employee's background check has a drug or alcohol infraction? I would talk to human resources. What I find on a lot of campuses is that student affairs folks typically tend to have responsibility for Drug-Free Schools and Campuses Act. Occasionally HR will, but when it comes to the Drug-Free Workplace Act, it usually is monitored by a business affairs or an HR function. So I would talk to them about their safe and drug-free workplace policy. in that policy, if it denotes the notification process, who should be notified, timeliness, those types of things. So I would turn it back to your HR folks or your business affair folks, because chances are someone within that domain has the responsibility for monitoring the safe and drug-free workplace, which would constitute, who do you notify if somebody has violated an alcohol or drug law off campus. We've talked about what a program is. We've talked about the Department of Ed principles of programming. We talked about the network standard, the ACHA standards. We talked about the college aim and provided a brief overview of that and how that might be employed to look at where you're at and where you're going, which really transitions into the biennial review process and what it is and what to do and how to do it. But before we start talking about the biennial review process, again, I want to see if anyone has any questions about what a program may or may not be, or anything that we've covered up to this point in time. Larry Allen has asked if the drug-free schools and campuses notice requirements are addressed in our institution's annual security report that is sent to all students and employers. Will that satisfy Department of Ed requirements for notification? I believe it should. I know campuses often bundle the two together. I'm not aware of anybody that has gotten in trouble for doing that. I think if that's your primary method, it should be fine based upon what I have been exposed to. I would go ahead and encourage additional methods of getting it out. I think the key that I would be cautious about, Larry, is again, a lot of times people see the distribution of the annual security report as a one-time event. So if you are only sending out that annual security report once a year, the question then becomes, how are you getting that annual security report to anybody who is new to the institution after your primary method of distribution? That seems to be one of the differences between Clary and drug-free schools, is that Clary seems like it's a one-time on the calendar. We send it out to everybody. Drug-free schools is really required. Everybody gets it at least once within 12 months. So as long as you have mechanisms in play to get that security notice out to folks after you've sent it out for your primary distribution, my assumption is that you would be fine. I would caution having too many notices in one document. Again, a few slides earlier, we were talking about one of the campuses. It was Occidental, and what they said was, you can't just have a statement that says all of the policies are here, go and read it. That's considered passive. So as long as you are actively disseminating the security report, everybody is getting it. Everybody is getting it within a 12-month period. You should be fine. At our institution, before we went to electronic dissemination, we would actually have a 24 by 36 inch double-sided document that would be folded into a small brochure. One side would have all of the campus security information. The other side would have all the drug-free schools information. And we did that for many years. So I think you would be fine. I don't think it would pose too big of a problem. Any other questions up to this point in time? Okay, we're going to go ahead and move on to the biennial review. The biennial review, basically we are required to review our alcohol and other drug programs and policies every 2 years, hence the biennium, the biennium. One of the questions I often get asked is, when do we have to do this? What are the timelines and those types of questions? If you look in that guidebook that I talked about earlier at the beginning of the webinar, the book that I referred to as the Bible, there's nothing in it that really says, thou shall do it at this time by this date. There are some recommendations, and those recommendations are probably what the Department of Ed, if they were to come to audit you, would expect. But again, when you look at the actual regulations, there's nothing that really says you have to have it done by this date. It covers this time period. Again, very different than our experiences with Clary. Clary is very specified, very precise. This tends to be a little bit more ambiguous and vague. As a matter of practice, we typically look at biennial reviews in even-numbered years. And the main reason for that stems from, if you go back in this webinar when we talked about the certification, schools were asked to sign off on that certification in the fall of 1990, meaning that they were to have their first biennial review completed in 1992. So as a result of that action and the request that everybody sign and submit that certificate in 1990, that is where the practice of doing biennial reviews during even number years stems from. I've talked with schools that for some reason or another were not doing it, realized that they needed to do a biennial review, and they started where they were, and they do it during odd years. I've not heard of anyone getting in trouble for doing it during odd years. I think the important thing is that you are doing something on a biennial basis. Likewise, there's no specific date in which the report is to be filed. As a matter of practice, what I find most people do is that they will make sure that the report is completed and filed by December 31st of an even year. And when they do their review, they cover the previous 2 academic years. So if we were to look at that practice as it currently is, you should be working on your biennial review currently, have it done by December 31st, and you would actually end up looking at FY17 and FY18 if you were looking at a July 1st through June 30th calendar year. I've had some institutions that I have talked to that have been on the quarter system. Other institutions, school year, wouldn't necessarily start when many other institutions do, but as long as you have some consistency of, this is our 2-year period, this is our period of review, it should work and suffice. Now, when we look at the Drug-Free Schools manual, and this is a web capture from that book, again, it says the regs do not specify a date by which the biennial review must be completed and on file. They simply require that a campus complete a review every 2 years. We talk about the long practice of it being on an even year. Based upon the tradition, what they suggest is good sense suggests that a biennial review be completed on file by December 31st of each even numbered year, and the report should cover the previous 2 academic years. For example, the 26 biennial review, the dates should include September 1st through August 31st, September 1st through August 31st. I'm guessing September 1st through August 31st would be an academic year, or the Department of Ed's assumption of an academic year. So again, you know, for your biennial review, are you looking at a fiscal calendar year, Are you looking at an academic calendar year? Are you looking at a federal calendar year? I think there is some leeway there. I think it just depends upon what you're defining, but you need to be consistent regarding that. Now, when we look at the biennial review, we have to realize that there are two key components. One is to determine the effectiveness of our comprehensive substance abuse prevention program and implement changes if they are needed, and also ensure that the sanctions developed for our policies are consistently enforced. This concept of a biennial review is not intended to be a brag document. It's not intended to list everything that we feel that we're doing great and good. We want to include that information, but really it is a quality improvement process. It is a strategic planning process. When I talk about this to folks outside of substance abuse prevention, I use the analogy of the process that many of our institutions go through for accreditation. The biennial review is really kind of a self-study process. We should be collecting information. We should be collecting data. We should be looking at programs, processes, and interventions. And through that process, we should be doing some kind of analysis. I like to use the SWOT analysis. We're looking at our strengths, our weaknesses, our opportunities, and threats. And once we have done that, then we are developing some recommendations and some plans of things that we are going to do as an institution during our next biennium to further strengthen our programs, policies, and procedures that are intended to reduce alcohol and other drug use. But again, we need to be looking at both of these key functions. Just looking at our programs and what we're doing in terms of our educational programs and our interventions is not enough. We really need to be looking at policy and policy enforcement as well. When we look at biennial review best practices, there are some things that seem to stand out among better biennial reviews. In the late 90s, mid 90s, the former National Higher Education Center did collect some biennial reviews from institutions across the nation with the intent of reviewing them for training purposes and professional development. And what they found from their qualitative study was that, you know, the best biennial reviews looked at comprehensive programs. So it was more than just the educational programs. They were looking at interventions. They were looking at policies. They were looking at policy enforcement. And those that seemed to stand out were looking at evidence-based strategies of practice. The best biennial reviews had data collection. So a lot of times those biennial reviews, the campuses were doing some kind of data collection, whether it be the core alcohol and other drugs survey, the National College Health Assessment, that there was some survey looking at behaviors, perceptions, and attitudes, that when the biennial reviews looked at programs, they were looking at programs across the spectrum of many different subpopulations on campus. So they just weren't targeting and addressing high-risk drinkers, but they were looking at non-drinkers. They were looking at problematic drinkers. They were looking at those in recovery. And again, all of this data collection and all of this review resulted in the creation of a strategic plan of action so that there was some direction somewhere that the institution was planning to go and move forward with its comprehensive substance abuse prevention program, and that these efforts, while possibly being led by one person or one department, really involved multiple parties, multiple units, and often resulted in the creation and the formation of a task force or a campus-based coalition. Along similar lines, when you look at the content of a biennial review, it really looked at, you know, the different programs and interventions that you were doing on your campus. So, you know, you reviewed those, you included descriptions of those in your report, you had a statement of goals and goal achievement. So if you had done your last final review 2 years ago, and at that point in time you said, we expect to see this reduction in underage drinking, this reduction in binge drinking, we expect to see an increase in alcohol policy violations because we're going to increase enforcement. Whatever goals you had stated during the last biennial review, you're actually going back to revisit in this report and this review process to determine what success you had, what failure had, and then kind of an explanation of why you may not have made the progress you were hoping to make. Summaries of your programs and interventions. I see a lot of schools now putting copies of all their policies in that biennial review report to show that they have numerous policies. And again, really looking at the strengths and weaknesses, opportunities and threats of your programs, your interventions, and your policies. One of the other things a thorough biennial review report would include is a section on how you are distributing your drug and alcohol prevention program notice, how you're getting that out to students, how you're getting that out to employees. You would include a copy of that DayUp as an appendices, but most importantly, at the end of the biennial review, you're really listing your recommendations for revising or improving your alcohol and other drug programs. And then you also include supporting documentation. So if you are doing a core survey or a national college health assessment, you might be including either an executive summary of that document, or if you've done some more detailed data analysis specific to substance abuse, you might be including a summary of those results. The National Higher Ed Center analysis, if we narrow it down, many of the same things that we've talked about, goals, recommendations, task force. So we will quickly skip this slide. So when you sit down and you start a biennial review process, if you've not started one or if you've done one in the past, I always recommend the group, because I like groups. I think groups are important when it comes to the biennial review. That way you're not limited to one person and one office and their biases. Sit down and kind of brainstorm all the potential data points that exist on your campus. Chances are there are a lot, and that is part of the reason for group brainstorming, because it's real easy for one person not to think about this data point or that data point. Some of the clear and evident data points would be, if you're doing a survey, if you've done a survey on campus, what does that data say? Probably for many campuses, especially if you're a residential campus, there are policy violations, particularly in housing. Even if you're not a residential campus, you may have policy violations. So what alcohol and other drug policy violations do you have through your student conduct office, through your dean of students office, through your law enforcement, campus security? What does your Clery data say regarding alcohol policy violations? Those are some easy data points to collect if you have it. Some other campuses may look at transport. So if you have a relationship with local EMS, or if you have your own campus EMS, how often are they transporting students for alcohol and other drug use? If you have a medical center, a health center, a counseling center on your campus, is it possible to get the number of admits and diagnoses related to substance use disorders? Again, there's lots of different data points that you can get to get a big picture of what's going on your campus. Now, when we look at the regulations and we look at the Drug-Free Schools and Campuses Manual, there are some suggested data points that they really recommend a campus making sure that they have in their biennial review. And one would be the number of drug and alcohol related disciplinary sanctions imposed. That data should be information that you can easily get from your student conduct office. The number of drug and alcohol related referrals for counseling or treatment. Sometimes counseling centers are very wary of giving this data. What I typically will tell my medical folks and my counseling folks is, I don't want names, I don't want descriptors, I just need the number of diagnoses. I need the number of referrals off campus. If we've sent students for intensive inpatient, I just need generalized numbers. I don't need any identifiable information. The number of drug and alcohol related incidents on campus police logs, again, that's Clary related data. The number of drug and alcohol related incidents of vandalism. This may be a little bit more difficult to get. If you're a residential campus, it's probably a little bit easier to track that in terms of on-campus in residence violations. The number of students or employees attending self-help groups or counseling groups. So if you are offering those groups on campus, what does your attendance, your process metrics look like? And then tracking student, faculty, employee attitudes and perceptions about alcohol and other drug use issues and problems on your campus. That may be a little bit more difficult, especially if you are not employing survey instruments such as the core survey or the National College Health Assessment. Again, when we review our comprehensive program, looking at programs, educational programs, interventions, and policies, we need to be looking at all three things. I like to use matrices. And what you will see on the slide is a matrix, and you will see two axes. The top axis going across the top row is really the social ecological model. And for those of you not familiar with the social ecological model, it's a model of concentric circles, and we look at things at the individual level, the group level, the institutional level, the community level, and a policy level. Policy typically tends to be state or national policy. On the far left column, you will see the network standards of policy, education, enforcement, assessment, and community mobilization. So I like to sit down with groups and say, okay, let's brainstorm and create a list of all the different educational interventions, policy interventions, treatment interventions. What are all the things that we do on this campus to address substance abuse? And we brainstorm that list. And then what we end up doing is we say, okay, for this intervention, this program, this policy, where does it fall at in the cross section? So basics would be an individual educational program. So we would put it in the box where individual and education cross, and we would do that. The nice thing about this kind of matrix is it gives you an overview of everything that you're doing, and it may help you identify some areas that you can improve upon, or some areas where you have complete overkill and maybe not need to do as many things in that one box to shift some resources over to another box. A similar matrix would be the social ecological model by the SAMHSA prevention strategies. SAMHSA has 6 prevention strategies: information dissemination, education, alternatives, problem identification, referral, community-based processes, environmental policy. Again, brainstorm everything you're doing, figure out what boxes they fit in, figure out what your strengths are, your weaknesses are, and maybe some areas that you might want to do something differently in. When we are looking at campus prevention programs and interventions, many of us often collect process summary or performance metrics for our programs. You know, the number of times we offer a program or a presentation or an intervention, the number of people who attended that presentation. A lot of times we may collect satisfaction results. That is important data. You may not need to include every single bit of evaluation and assessment that is done. You may want to include key highlights, key summary points, but at least that shows that you are doing something on a program or intervention level to assess effectiveness. And you really have to start where you're at. I mean, ideally, we would hope that many campuses are looking at student learning outcomes, attitudinal changes, behavior changes, those types of things. But you've got to start where you're at. So if all you're doing is collecting process metrics, process data, satisfaction data, that's what you have, that's where you need to go. One of the points that I would like to highlight is that I think the Department of Ed is beginning to get more rigorous when they come and do audits in relationship to the data that is collected for a biennial review. And what you will see on this slide in the white box is actually a web capture, a screen capture from the University of South Alabama's program review findings. And what you will see is that they were not doing a biennial review if you read the report. So now they're required to do it. And basically, as part of their corrective action plan, is that they are required to describe the research methods and data analysis tools that will be used to determine the effectiveness of the program, as well as the responsible official or office that will conduct the review. So tying into one thing that I said earlier is, I recommend that every campus have an office or an individual that is clearly identified as being the person that's in charge of the review as well as the notification distribution. We're beginning to see much greater rigor in the biennial review process. What are your research methods? What are the data? And how did you derive those decisions? So when we look at data, a wide variety of things, you probably have more than enough data on your campus that directly links to alcohol and other drug use, as well as data that may be indirectly linked, such as grade point averages, attrition rates, completion rates, generalized data for your campus that you can tie in. But it seems like the department is beginning to expect greater and greater rigor. Just to put it in context, I have a colleague, they were well notified that they would be having an audit. Several weeks before the date of the auditors coming, they were sent an email and they were asked to submit their biennial review, their drug and alcohol prevention program notice, a few other things. And then a week before the audit was to occur, they were asked to actually submit an outcome-based evaluation plan for one of their educational programs. It wasn't specified which educational program. They were just asked, can you provide an outcome-based evaluation report for one of the educational programs that your institution has delivered? So they were able to do that. But again, it seems like there is an increase of rigor regarding evaluation and assessment that the department is beginning to lean toward. Policies are also interesting. They really want us to be looking at our policies. They want us to be determining how effective our policies are. They want to make us, they want us to make sure that we are being consistent in the enforcement of the policies and the adjudication. They want to make sure that everybody, regardless of their affiliation, is held to the same policy standards and offered the same interventions. So one of the areas that I often find after doing this webinar or talking with schools is that, they've covered the programs and interventions really well, but they've not given a lot of thought or time to policies. My same friend who had to provide the report for an outcome-based evaluation study of an educational program was also asked to submit an Excel file looking at the consistent enforcement of alcohol policy violations and sanctions between student athletes and non-student athletes. And what she was asked to send was an Excel file, and every single student that violated an alcohol policy was considered a case. And in that Excel file, they had to denote whether or not the student was an athlete or if they were a non-athlete. And then they were to list their commonly held sanctions and fines for, say, minor in possession, underage drinking ticket, And then they were basically to report what consequences the students got. And then they had to really look at whether or not student athletes were being sanctioned the same as non-student athletes. And then I think they also had to look at a percentage to see if a similar percentage of the general student population was being sanctioned for alcohol policies compared to a similar percentage of athletes. What you will see on the slide right now of the webinar is something that I made up. If you look at it, what you will see is that non-student athletes, they all had to pay a fine. The student athletes did not. The student athletes ended up having a paper where the non-student athletes were more likely to have an educational class as well as basics. I made this deliberately to show great differences, but I would imagine that if you looked at different groups on your campus, you would find differences. It may be as simple as in one residence hall building, you have a pretty conservative residence director that has conservative views about alcohol. In another building, you have a more liberal residence director who has more permissive views of alcohol or other drugs, and you may have students that end up having the same violation. The students in the conservative hall end up getting nailed to the wall, having to pay fines, whereas across the quad, a less conservative, more permissive hall, same violation, same behavior, but a much less or reduced consequence. Another area that you may see this is if your athletic department does not have a universal alcohol and drug policy across the entire department and it's left up to teams. Coach A may be more permissive and let students off with a lot more than Coach B, who's more conservative and nails students to the wall. So again, this is a possibility. I've heard this from several colleagues who have been audited that they want to see this kind of documentation to show that sanctions are being consistently enforced across campus, as well as sanctions are uniformly being adjudicated regardless of affiliate group. So it's important to take heed of this and look at policies that way. I, again, liken this process to accreditation. So if you've gone through these slides, by this point in time, you have brought a team together, you have collected a lot of different data points, you've kind of gotten a picture of what your campus climate is. You may have begun to identify some of the strengths of your campus, some of the weaknesses, some of your points of concern. You've looked at your programs, your educational interventions. You've looked at your policies. You've looked at how things are enforced, how sanctions are applied. And from all this data that you've collected, you can really now sit down and say, these are our strengths. These are the things that we're doing well. These are the things that seem to be going excellently. Here are some concerns, here are some weaknesses, here are some problematic areas, here are some opportunities, here are some threats. And once you have done that SWOT analysis with your biannual review, you then can create some conclusions. And from those conclusions, you can determine whether or not previous outcomes and goals and objectives that were created in your last biannual review have been achieved. Have they been met? Have they not been met? And then you can also start developing outcomes, goals, and objectives for the coming biennium and what will go into the next biennial review report. And part of that should be looking at what changes you need to make, what changes need to happen, how can those changes occur, what resources that you need. Again, the biennial review process really becomes kind of a strategic planning process for your campus. One of the documents that you have as a handout is a suggested biennial review format. I'm kind of a nerd. I'm kind of geeky. Those of you who know me would say, yeah, that's Eric. But I got bored one Friday afternoon and I just sat down and I said, what would the world's most perfect biennial review report look like? What would be in it? And I went for overkill. So again, I offer that to you as a template to look at. Not that you necessarily have to use it, but it may give you some ideas for those of you that already have a biennial review, things that you might include and add to it. And for those of you who have been neglecting to do your biennial review, it may start as a good starting point of things to collect and things to look at. The slide up here kind of gives you a brief outline of things to include: an introduction overview, biennial review process, your comprehensive goals and objectives being reviewed that were set 2 years ago for this year, your annual policy notification process, prevalence data, incidence data. That'd be things like your core data, police data, judicial data, those types of things. Any needs assessment data, trend data would be like things as the core report, the National College Health Assessment, other survey trend data that you might have, policy enforcement and compliance. So that would be the section looking at your policies, intervention, inventory, and related outcomes. That would be your educational programming, your other program efforts, and then, you know, kind of formulating what your goals and objectives are for the next 2 years, your strengths, and then really sitting down and saying, I'm sorry, excuse me, your goal achievement be what you've done for the last 2 years and where you're at today, your strengths and weaknesses, your recommendations for the next biennium, and then your goals and objectives for the next biennium. And again, like I said, it's a very nice strategic planning process. What I would like to do, if it's possible, is I would like to go ahead and take a 5-minute break. I know we've been at it for a long time. We probably have about another half hour to hour or so to go. So let's go ahead and take a break and reconvene at 12 o'clock your time, if that's okay. Hello, this is Eric. Hey there. Okay, we're going to go ahead and reconvene. We have one more section that we're going to cover, and this should be covered very quickly. Apologies for running over a little bit, but what I wanted to conclude with before we move on is this last section regarding audit conversations and some information that I have gotten from other folks. One of the things that most people are saying, and what I've learned, is that the auditors who come and audit are not health promotion, counseling, student affairs folks. Most of them are lawyers. So unless they have been focusing on Drug-Free Schools and Campuses Act, they may or may not know a lot about health promotion, health behavior, substance abuse prevention. A lot of times when the auditors come, they're looking at a lot of different areas. They're looking at a lot of different mandates. So they have a surface knowledge of the mandates. And what they end up doing is that they will kind of do a surface collection. They will do a surface interview. They will take things from you. And then they kind of have a deep analysis and will let you know how you did. And then they go and they review materials more intently. What I've also heard from folks is that there are varying notification times. I've had some folks who did not know that they were being audited until that morning, and then they had like 10 or 15 minutes to get across campus with all their information. Others knew well in advance. I think a lot of that depends upon the relationship that you have with your financial aid folks, your clery compliance folks, and whether or not they have let you know that they're actually being audited, and that will be part of the Drug-Free Schools and Campuses Act. Data is key. How do you know what substances are an issue on your campus? How do you know that programs and interventions are working? How do you know that policies are working? You just can't sit around a table and be very anecdotic, have a lot of anecdotes. You got to have data to support it. They want evidence. Evidence. So one of the things that I've heard through NACOP, particularly with clery, but it also applies to drug-free schools, is if you are sending your notice out electronically, make sure that you have hard copies available and on file, and then also watch out for overriding. Evidently, there have been schools that have written their policy and their notice in a Word doc. They go in, they revise the Word doc, they save it, but they don't save it as a separate, different document. They just keep overriding, and once they do that, they didn't have hard copies, and they got in trouble for that. So make sure that you have evidence for that. We've talked about the consistent sanctioning, so make sure that you're looking at those things. And one of the themes that seems to be coming mainly from West Coast folks is the role of faculty. How are faculty involved in writing and disseminating your drug and alcohol prevention program notice? How are faculty involved in implementing your comprehensive prevention program? How are faculty involved in the biennial review process? I've had several folks from the West Coast, California, mainly saying that they have really been asked a lot of questions about the role for faculty and really having to explain how higher ed works and how prevention tends to be a student affairs function and kind of the division of labor and siloing that goes on in higher ed. Not certain if we will see that on the East Coast, but again, I've had it come up numerous times with folks on the West Coast. Again, a lot of questions of who are involved in your biennial review, how are faculty involved in that process, and again, as we've alluded to several times, who's ultimately responsible for ensuring that your institution is compliant with the mandate. One of the sections that I would normally talk about is medicinal legalized and or decriminalized marijuana, but because we have run over on time, I will skip that for the webinar. We will make sure that these slides are put into the PowerPoint that is sent out to all the registrants. I am actually working on about a 60 to 75-minute webinar, really dealing more in depth with this. And what I've shared with Marianne is once I get that done, as we share that with the folks in Illinois, I will let Marianne know, and we will contact the registrants of this webinar and invite them to that webinar as well. So if any of you have an interest in the interplay with marijuana, federal law, and drug-free schools, and how that may interplay or not interplay with your state and local laws, we can cover that in a separate webinar. So having said those things, we will send the PowerPoint, the handouts, and other documents to you through email. We have made a recording of this webinar, so we will be posting that webinar on YouTube, and we'll be able to provide you with the URL for that as well. It will probably take us a few days to be able to do that. So with that, are there any last questions that anyone has that we have perhaps neglected or not covered today?
And Eric, after you answer any further questions, I just have some closing comments.
Okay. It does not appear that anyone has any questions. If you do have questions, the slide that is up right now has the IHEC phone number. It also has my email. Email is probably the best way to get a hold of me. And if you have any questions, please feel free to contact me directly. And I'd be more than happy to entertain your questions and give you my knowledge and my thoughts. And with that, I'll turn it back over to Marianne.
Okay, thank you, Eric. And I truly want to thank all of you that have been on the call today. I know how many plates you each twirl and how time is precious. If you have any other question regarding today's webinar, as Eric said, feel free to contact him. Also, if you have any questions on how the New York State Office of Alcoholism and Substance Abuse Services efforts to address collegiate substance abuse, you can also contact me. I think that all of you have my email address, and once today's webinar is over, at some point you're going to receive a survey on the presentation, and we truly would appreciate your feedback on it. You'll, as Eric said, in probably 24 to 48 hours, you'll also receive the information that was presented today. I also want to remind the alcohol and drug coordinators that are on the call that we're looking forward to a call also on November 2nd. So perhaps you'll have some follow-up questions on this. So on behalf of the Office of Alcoholism and Substance Abuse, the State University of New York, and the Office of University Life here at SUNY, and of course our presenter, thank you for joining us today, and have a great afternoon.